Thinking about getting cyberbite piercings. You know, the one that's Medusa and a center labrae. So they're like beaks, kind of, sort of. Not really, though. Well, I'm going to tell you everything you need to know before getting that done. Coming up next on Consultations by a Piercer, episode number 38. For those that are new to the channel, welcome to the channel. Welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here inside, in Des Moines, Iowa, inside Skin Kitchen Tattoo. Now, the piercing we're talking about today is a combination or grouping piercing, oral one. It is a Medusa, which is that centered area on the top of your lip, and then a labrae stud down below. We call this grouping cyberbites. So cyberbite piercings or cyberbites piercings. I never know if you're supposed to do the S on both of them, piercings and bites, or just do it on one. It's always confusing. Average healing time on this is anywhere from 8 to 12 weeks, during which, for the first 2 weeks, I'm going to suggest that you rinse with Biotine antiseptic mouthwash a couple times a day or an alcohol-free mouthwash. Also, I'm going to suggest rinsing a couple times a day with warm water and sea salt, basically 1/8 of a teaspoon of sea salt per cup of warm water. And that's for the first 2 weeks only. Throughout the entire healing period, you want to clean it twice daily using a saline solution. There's kind of two main types, and it has to do with the way they're delivered. Now, if they come out in a fine mist, like what I suggest, which is Neomed's Piercing Aftercare, then you just spray it directly onto the piercing. If it comes out like a squirt gun, then you're probably going to want to do a compress. In that case, you saturate or spray a clean, sterile piece of cotton sponge or folded up paper towel and then lay it against the area. Both cases, you want contact for at least 5 minutes and then pat dry. Now, if you can't find Neomed or something of that brand, like Neomed's Piercing Aftercare or Wound Wash, there are various different other ones on the market. The main things you want to look for is it's in a pressurized can and it flat out says sterile on the packaging. When you turn it over into the back, it should say ingredients, sodium chloride, and a purified water. Nothing else. The other thing I suggest doing is at the end of your shower, pull your hair and everything out of the way and let the water flow over the piercing area for about 30 seconds. Or piercings. Both of them, yes. What we're doing with the saline and with this rinsing in the shower is we're removing that hardened, crusty discharge that hardens and collects on the jewelry. The main reason we want to remove it is when you move and you eat and you talk and etc., that can agitate the piercing. It can also be very uncomfortable. If you get to a point where there seems like there's an excessive amount on there or it doesn't seem like it wants to come off, see your piercer. Have them clean it. There might be something else going on. Don't go to the bathroom closet and start pulling out everything that's got cotton on the tip or is a sharp implement. You're probably going to cause more problems than good. Now that we've talked about what you need to do, let's talk about what you don't want to do. Cross-contamination, prevention. This is common sense stuff that'll help you reduce the likelihood of infection. Starting with, wash your hands before you handle it. Always handle it by the ends whenever possible. Really, the only time you need to have any contact with these piercings is during the healing process anyway, is when you're checking the tightness of the ends, which I suggest doing about once a week. Rest of the time, leave them alone. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. You are more acceptable to STIs during oral sex. So if you switch partners, practice safe sex the way you're supposed to. Do not stick unclean objects in your mouth like pin caps, toothpicks, penny nails, hairpins, rocks you found at the playground. All this stuff is going to be filthy, and it's just going to increase the likelihood of infection. Make sure your utensils are cleaned on a regular basis, and do not share food items or utensils with other people until this piercing is completely healed. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned and changed on a regular basis. Keep pets away from it. Don't let them sleep in the bed with you, especially the smaller animals like to sleep up by your face and lick you and etc. in your sleep. Keep them out of the bedroom until these two piercings are completely healed. Now let's talk a little bit about trauma, swelling, and abuse. Do not sleep on these piercings. I don't know how exactly you would, but don't do that. Don't try to. I guess if you slip flat on your face, you can kind of do that, but it doesn't sound very comfortable. Do not spin the jewelry. Do not rotate the jewelry. Do not move the jewelry. Leave it alone. Also, do not do things like push on it with your tongue to see if it still hurts, or do stuff like chewing on it or putting it between your teeth. All these things are going to lead to issues. Let's talk a little bit about the first couple weeks. First off, you have two piercings you're dealing with here, and that complicates things a little bit more. You may, if you don't want to deal with two of them at a time, you may want to pierce one and then the other one, and I'll get into that a little bit too. Each of that possibility has its own advantages. You kind of want to stick with simple diets, especially for the first 3 to 5 days. Things like yogurt, sports shakes, baby food, applesauce, ice cream, soups, anything you can get through your mouth without chewing. The more movement you have, the more swelling you're going to see and the more discomfort you're going to experience. Eat very slowly and carefully. It's going to take you a little while to get used to having the jewelry in your mouth. It's not as big of an adaptation as, say, a tongue piercing is, but it can be a little tricky at first. Mainly in part because you have longer jewelry in than what's going to be the end result. To reduce swelling, you want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, vaping, or anything that may agitate your mouth. Listen to your body. If it hurts to ingest something, stop ingesting it, or at least try to cut back until it no longer does. Like I said, first 3 to 5 days, we're going to stick with that soft diet. After that, once the swelling starts to recede, you can slowly start to wean yourself onto solid foods. Stick with kind of simplistic things. Think about when you eat something, how often it gets caught in your teeth and your gums and how much you have to move things around in your mouth. And try to avoid those type of foods. Like crackers would be a good example. Stick with things that you can kind of cut up into small pieces and shove back into your molars. That movement, because there's during the chewing and etc., can agitate the piercing, which is going to prolong your swelling, and it's going to make it uncomfortable. So if you can kind of reduce that for a little while and just slowly, carefully bring your eating back to normal, you're going to have a better experience. I also avoid large objects, things like huge triple stack sandwiches, because opening your mouth with these two piercings is not going to be comfortable. How to reduce swelling? Stay hydrated. You're usually going to see the worst of the swelling first thing in the morning. Usually on these, about the second day into the healing process is usually when it happens. If you can get a glass of water at night, it's going to help. Also, gently sucking our ice chips and eating cold items for those first couple of days can help greatly. If you've never had issues with over-the-counter anti-inflammatories such as ibuprofen, or it doesn't affect your for health reasons you can't take it, that will help sometimes with swelling. Also, sleeping with your head above your heart will help reduce the amount of swelling you see, especially first thing in the morning. The other thing is stay away from carbonated beverages and salty beverages. Both of those things will cause additional swelling. Let's talk a little bit about the risks involved with this. Any oral piercing, you're going to have risks to enamel erosion, gum erosion, and softening of the bones inside your mouth. With this, because you have two piercings, you have double the risks, and they're in two different locations, so you cause damage in two separate areas of your mouth. You can greatly reduce this by having the correct placement for the piercings, and also downsizing to shorter jewelry on a timely basis will eliminate the contact it has with your teeth. The other risk is swallowing jewelry parts. This is why it's important to check the tightness of the ends on a regular basis, even after the piercing is healed, just to be on the safe side. Not only does it suck to lose ends, they usually end up in the corner of the room where you'll never find them, or underneath that little wedge spot between the sink and the toilet, or underneath the refrigerator, or someplace where you'll never find it. So that's not only a pain to have to go buy another one, but it's also can cause this problem where you may swallow the jewelry and not even know it because you have a mouthful of food, or you can lose the piercing because you didn't get the jewelry back in time. Now let's talk about placement, angle, and jewelry types, or what I suggest as far as that. First off, the placement on this, you're doing two piercings that are fairly common and commonly done. The first one being a Medusa, which is on the top lip. It's done either above the gum line or below the gum line, and below definitely the florinium tendon. If you take your tongue and stick it up inside there, you'll feel a tendon. You want to be below that. You do not want to pierce through that. If your tendon is too long, that's the one case where your anatomy is just not correct for this combination of piercings. For the bottom, basically the same thing, done dead center, below the gum line or above the gum line. If you plan on wearing circular jewelry in the bottom one, then it needs to be done as high as possible. Some people consider a vertical labret with this on the bottom as a cyberbite. I don't think it's the same thing. It should be its own little thing because it looks completely different. Now, the angle should be pretty much at a 90-degree angle that matches the tissue so that disc on the inside will sit flat. Oftentimes, because when we pierce with long jewelry, it sticks out and it looks like it's going up or down, and that's more to do with how that tissue is. And once you put that shorter piece in, it usually solves a problem. But at first, it might look a little bit off. But there's a reason for it, because we want that disc to lay flat against the back. Now, during, and after, and before, your piercer may make you, or ask you. They can't make you do anything you don't want to. They're going to ask you to make some funny faces. This is more to kind of determine how much you move your upper lip and lower lip, if they should be concerned because you do drastic changes in your expressions, and if it's going to cause a problem with jewelry coming in contact with teeth and gums. Plus, we kind of want to know what it looks like on the body and how it's going to sit with the body, and maybe adjust from there. Now, both are usually, it's best to mark both of them, even if you're only getting one done, to kind of know how the two are going to group together. It's just best to have everything planned out at once, not kind of added to later. Just to give you an idea if that's really even what you want to go for. When you're looking at the marks, you want to look at them up close, but then at arm's length. Normal people don't see you this close, and a majority of people don't see you this close. A majority of people see you this close. So what may appear straight and even at this length may not at this length, and vice versa. So always looking at them up close and at arm's length before you make a decision. Jewelry-wise, I really only suggest using a flat-back labret studs with these. I like threaded because it's a little bit more secure. I know some people will do it with threadless jewelry. There's not really anything wrong with that other than the fact that if it gets caught, it's going to just pull that in right out of there. So I prefer to do this with threaded jewelry. You do want to downsize in roughly 4 to 6 weeks to a shorter piece to cut down the amount of contact you have with teeth and gums. And also, it's going to make it more comfortable. Do check the tightness of the end throughout the healing period. They can come unscrewed sometimes on their own, and they usually fall off at the worst possible times. Now let's talk about pain in the piercing experience. Most people say on a scale of 1 to 10, this one's kind of between a 2 and a 3. Some people really are, it seems like, overly sensitive on the Medusa, more so the other one, and vice versa. Everybody's wired a little different, but it's probably not going to be as bad as you think it's going to be. One thing I'm always adamant about, this should be pierced from the outside inward, not the other way around. And the reason being is it's very difficult sometimes to match that up the other direction. And often that's when you get piercings that are off. So first, most people clamp with a set of Pennington forceps to help move the tissue into placement or where you want it. Inject the needle in and through. That's followed by a taper pin or a guide pin. The guide pin is attached to the jewelry. The forceps are taken off, usually before you do that. But then the jewelry's pushed in, guide pin's taken off, ball put back on, or in put back on. Usually, to be honest with you, the thing that usually takes the longest is actually threading the jewelry, either onto the guidepost or when you put the ball on. The rest of it's very, very quick. Sometimes there may be some slight bleeding because of that pin or guide pin being tapered. It kind of leaves an empty space that could cause a little bit of bleeding. Usually it's only slight, and most people don't even notice it. After fact, you might have some throbbing and aching for anywhere from 2 to 3 minutes and maybe some slight bleeding, but it usually doesn't last very long. Then it's going to be tender to the touch for a couple weeks in most cases. Now, take it slow. Take talking, eating, drinking, etc. slowly. It may be uncomfortable to do that. It may take a little while to adapt to that. So take it easy for that first couple days just to be on the safe side. Eventually, it will get better. Piercings sometimes, especially oral piercings, can be very frustrating during the initial healing phase. And at first, it seems like this foreign object is just going to drive you nuts for the rest of your life, and you can't wait to get it out. However, if you give it time, it eventually just becomes a part of your body and completely normal, and you don't even notice it. Now, let's talk about anatomy. I kind of talked a little bit about this earlier. Most people have the correct anatomy for this. The only thing that would keep you from getting this done is if your floronium tendon on the top comes way all the way down to your lip. I've only had like one person I think I've encountered in my 29 years of piercing that had this issue, but you can't pierce through that tendon. Some people, of course, have better anatomies than other people. If there's a lot of room between the teeth and the lip or the inside of your mouth, that's going to be a better candidate than somebody that's really tight and kind of thin-lipped. It varies from person to person, but a majority of people can get this grouping done. Okay, let's finish out as we always do with what you should consider. This is 2 piercings and can be done in 2 stages. What's going to work best for you? Dealing with all of it at once or dealing with one at a time? Maybe you've already got one of these and you're adding to it. There's no reason why you have to do these both at once. And if that seems like it's going to be too much of a hassle or too much to deal with, don't do both of them at the same time. Do one, heal it out, then do the other one. This will affect eating and talking for up to a week, week and a half in some cases. Plan accordingly. Have the food on hand before you go in to get the piercing done, the soft foods. If you have any work-related things coming up where you're going to have to do a lot of talking, maybe wait till afterwards or reschedule it. If you do a lot of talking at work, then maybe get it done on the Friday right after work of a 3-day weekend so you have that extra time to avoid talking. You will need to change your diet. There's no way around it. You can't just do whatever you want unless you want to see a ton of swelling. A lot of people are saying, I often with oral piercings, people are like, I can't quit smoking. I'm not going to. Cut back at least, because the more you smoke, the longer the healing's going to be, the longer the swelling's going to be, the more uncomfortable you're going to be, etc. Downsizing. I don't know how to stress this any other way than downsizing not only helps to reduce the risk of enamel erosion, gum erosion, and bone structure in your mouth, but it also is a lot more comfortable and makes the piercing look better. Always downsize. Most cases, most piercers will offer a discount when you come in and downsize to a shorter post. Some people will even give them away. Just do it. Usually about 4 to 6 weeks into the healing process is about perfect. Don't try to do it at home unless you have the proper tools to do it, though. Now, if you have any upcoming events or dinners, it's a good idea to either postpone them or get the piercing through at least that first swelling period of about a week and a half before that. Plan accordingly. Don't just expect everything to be okay. Are you going on vacation or doing some traveling for business? There's a couple different problems with going out of town and having healing piercing. First one is it's a hassle to heal with that piercing while on vacation. The other thing is that you're going to an environment that you cannot control how clean it is, and you may come in contact with pathogens that you have never came in contact with before and may have not built up an immunity for. The last thing is swimming. And I guess I didn't mention this in cross-contamination. I don't suggest submerging the piercing for any reason until it's completely healed. Anytime you get in a body of water that is large enough for you to submerge yourself in and move around in, it's going to be filled with microorganisms. You have 2 open wounds on your body. You're going to probably get an infection. Also, keep in mind there is no way to swim without getting water in your mouth. So think about that the next time you head off to the watering hole. And lastly, sports and hobbies and organized activities. If you're involved with anything that has a uniform or a dress code, or is, I don't know, you're a reenactment person, understand there's not going to be any way to hide this jewelry, and you're not going to be able to take it in and out during the healing process. And even after they're healed, you may not be able to hide them or take them in and out on a regular basis. It's best to wait either until, it's best to wait until you're just done with those activities, then get the piercings, or quit. When in doubt, if you're unsure if it's going to be a problem or not, go talk to the person in charge. Ask them their opinion. They're going to probably be the one that's either going to say, hey, you got to take it out, or you're not competing, or you're going to go home from work today. You're not working, or you can take the jewelry out. So talk to them ahead of time. Don't just get it done and expect them to just, I guess, roll over and let you do whatever you want, because a lot of times it's not their choice at all anyway. Well, if you have any experience with cyber bites, please leave a comment. But otherwise, that's about all I have to say on the subject today. Till next time, here's hoping you'll piercing seal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.